Otherwise it slips down my nose and
Yeah, that's fine.
becomes... Good, Alex.
Okay, ready?
Yes, good.
Prime Minister, what's the latest on the rollout of the vaccines across the United Kingdom?
Well, what we're doing here in Bristol today is launching the first of the mass vaccination centres. We'll have 50 of these by the end of the month. That's in addition to the 233 hospital sites, the 1,000 plus GP sites, and a first go of about 200 community pharmacies, and we'll be ramping them all up. As I speak to you today, we've done about 2 million people, maybe a bit more, were about 2.4 million jabs all in, I think, across the whole of the UK. And in the next few days, as we get towards that target of the 15th of February, 15 million that we want to do, obviously the NHS is going to be ramping that up massively. And it's still the case, as I talk to you today, that the UK has done more vaccinations than any other country in Europe, but we cannot be complacent. And the worst thing now would be for us to allow success in rolling out a vaccine program to breed any kind of complacency about the state of the pandemic.
Looking at the rollout of the vaccine, how
Yes.
confident are you that you can hit that target of the middle of February? A huge amount of ramping up needs to happen.
You're correct, Alex. It's a huge ask of the NHS, of the Army, of St John's Ambulance, all the other volunteers that you're seeing here today. Loads and loads of people are coming together to deliver this, and there's no doubt that it's a massively stretching target. I talked this morning
Is it achievable?
all our teams. We believe it's achievable. We're going to put absolutely everything into it. We're going to throw absolutely everything at it to get it done. Those first 4 groups by the middle of February. The over 80s, the over 70s, the clinically extremely vulnerable, workers in care homes, NHS staff. Those groups where we want to vaccinate. And today, I think I can confirm that we've done roughly 40% of the 80-year-olds in this country already. We've vaccinated 40% of the 80-year-olds in this country. So from now on, just in a couple of weeks, every single one of those will have a very high degree of protection. We've done about 23% of the elderly residents of care homes. And remember how important that is in fighting coronavirus. So, as I say, they will also start to have a very high degree of protection. But it's a race against time, because we can all see the threat that our NHS faces, the pressure it's under, the demand in intensive care units, the pressure on ventilated beds, even the shortage of oxygen in some places. And we've got to focus on what we all need to do together to bear down on the disease, to follow the guidance, protect the NHS, stay at home, protect the NHS and save lives. People have got to remember that key message.
Professor Chris Whitty said this morning this is the most dangerous time for the country in the whole pandemic. How worried are you about what's happening with the pandemic, the spike in cases, and what more do people and the government need to do to push down on the spread of this virus? I
think what Chris Whitty had to say this morning was absolutely right. This is a very perilous moment, because everybody can sense that the vaccine is coming in. They can see that the UK is vaccinating large numbers of those who need it most. And my worry is, and Chris's worry, is that this is the moment where that could breed a false confidence, false complacency. And that, when you look at what's happening in the NHS, is that complacency is not merited. We have a really tough fight on our hands. So what we will do is, of course, keep the guidance, keep the rules under review. But more important, as Chris said this morning, more important than us just pushing out new rules, people have got to follow the guidance. So in supermarkets, people need to be keeping their distance, making sure that they're wearing masks, doing the right thing. Supermarkets have done a fantastic job during this pandemic. Our country wouldn't have got through it without the work of supermarkets. We need to enforce the rules in supermarkets. When people are getting takeaway drinks in cafes, then they need to avoid spreading the disease there, avoid mingling too much.
But the rules are not as tight as they were back in March when you set the first lockdown. We have a variant that is much more virulent, 50% more virulent. We have 30,000 plus people in beds in hospital, the NHS under greater pressure than it was before. Should people be expecting further lockdown measures, and should you not be doing more to stamp down on this virus?
I think I really direct you back to exactly what Chris Whitty said earlier on this morning. We're going to keep the rules under constant review. Well, we have to tighten them, and we will. But we have rules in place already, which, if they are properly followed, we believe can make a huge, huge difference. And it's now that people need to focus. They need to be, when they're out shopping, whether they're buying cups of coffee in the park or whatever it happens to be, they need to think about spreading the disease. And as Chris said, one contact that you have can be a chain of transmission for this disease. So now is the moment for maximum vigilance, maximum observance of the rules, and of course, if we feel that things are not being properly observed, then we may have to do more. But far better for people to obey the rules that we have than simply to promulgate new rules.
The message is stay at home, work from home if you can.
Yes.
Was this an essential journey for you to make with your team to travel from London to Bristol today? Surely, if the message is stay at home, work from home, why have you travelled over 100 miles today to come here?
I've come because it's part of my job, and you'll know that the guidance also says that when you should go to work and do your job normally if you absolutely have to. And I think it's essential that I explain to the public what we're doing to roll out the mass vaccination centres. Essential that we get the message across about what's happening across the whole of the country. But I like the spirit which you're asking the question. Everybody should be asking themselves whether they need to be leaving home, whether they need to be doing something that could actually end up spreading the disease.